Hi, I'm Dr. Atkins. In this video, I'm going to go over some tricks I recommend to my patients that are addicted to nasal decongestant sprays to help them wean from the sprays. The basic concept is that if you can keep the spray out of your nose for 36 to 48 hours, it will wash out of your system and you'll be able to breathe a lot better. So here's what you need to do. About 10 days before you want to wean, you need to go to the pharmacy and pick up a few things. The first thing you need to get is a nasal steroid like Flonase or 𝐦𝐨𝐴. Now, I know what you're saying, hey, those never worked for me before, I don't really want to use them. Well, here's the deal. If you use the Afrin in the 10 days leading up to your wean and it opens your nose up a little bit, at that point, put the nasal steroid in there. It's not going to work like Afrin, but it will help cut down on the inflammation in your nose a little bit and make your wean easier. The second thing is get some Mucinex D from your pharmacist. You don't need a prescription, but you do need your driver's license. It comes in 2 strengths, regular and extra strength. Ask your pharmacist which one they recommend for you. Then you need some hypertonic nasal saline. That's extra salt in the nasal saline. I prefer the one shown here, which is the NeoMed Mist in the hypertonic form. Make sure you get the green bottle. Then you need some Breathe Right nasal strips. You know, the kind that go over the tip of your nose to help hold the edges of your nose open so you can breathe a little bit better. And you need to get some nose cones. These are little silicone baskets that you can put inside your nose to help keep the edges of your nose open and keep your breathing better while you're so congested. You can usually get them at local pharmacies like Walgreens or CVS, but you can certainly get them off Amazon. And the Max brand that's shown here is very popular. Then you need to pick a day where you don't mind being a little bit miserable, okay? You may not be that miserable, but kind of plan on it. That way, if you're not, it'll be a benefit and a blessing for you. About 10 days before you plan to start weaning, start using your nasal steroid. Like I said, when your Afrin works, use the nasal steroid. Only use it once a day, but kind of pick a point where your nose is pretty open. That way you'll get the nasal steroid in there and start cutting down on the inflammation. All right, it's the day you've decided to wean from the Afrin. Step 1, don't use your Afrin that day. Step 2, take your Mucinex D first thing in the morning. Then you need to start rinsing with your hypertonic saline. You can use this every hour, all day long if you want to. It will help draw out some of the swelling in your nose. And you need to use your nasal steroid in the morning, 2 squirts on each side, preferably after you've used the hypertonic saline so you don't rinse the Flonase or 𝐦𝐴𝐴 out of your nose. Apply your Breathe Right strip and use your nose cones if you feel like you need to. Try and stay active during the day. It keeps your mind off the fact that you're very congested. Now, about 12 hours into your wean, you need to do a few things. You need to repeat your Mucinex D because that can be used twice a day. You need to reapply your Breathe Right strips if they're getting loose, and continue to use your hypertonic saline. Now you're getting ready for bed. I would recommend you use your nose cones. They work particularly well while you're sleeping. Make sure you sleep with your head elevated, either on several pillows or a wedge pillow or in a recliner. That will help keep the swelling down in your nose. It's the next morning, day 2. You need to repeat the steps of day 1. Use your Mucinex D, rinse your nose with hypertonic saline, use your nasal steroid, reapply your Breathe Right strip if you need to. You can continue to use your nose cones if you think it's helpful. If you do get a huge improvement in your breathing, it means you've washed the Afrin out and you're on the verge of kicking it. You can continue to use your hypertonic saline and your nasal steroids and Mucinex D if you think you need it. If you don't notice any improvement by 48 to 72 hours, you may be what I call a type 2 patient, which means you have an underlying problem that's causing your nasal congestion, not just your Afrin. Patients that are a type 2 patient probably need to go see a doctor to get some help, like some steroids or antibiotics, along with following this protocol to kick the Afrin. Now, let me give you a little pep talk. I saw a patient a few weeks ago. He's about 35 years old. He didn't speak English. His wife was translating, and I explained this whole protocol. And he kept going, no, 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 no. And I took that to mean, no, he wasn't going to do any of this. Well, he comes back 2 weeks later, and his wife explained to me when they got to the car, he meant no, no, no. He's not going to do any of this. He's just going to stop Afrin because I told him if he stops it for 48 hours, he'll be fine. So he went home, didn't do any of this protocol, just quit using Afrin for 48 hours, and I've never seen a happier patient. He didn't speak English, but the hugs and the handshakes and the grin were all I needed to know that he did a great job and he was super happy he wasn't addicted to Afrin anymore. So you can do it without this protocol, but the protocol helps. Just make it easier on yourself. And again, if you can't make the protocol work for you, you probably need to get some medical help. Thanks.